I'm Dr. David Hill, and today we're going to talk about natural cures for cold sores in infants. Now, I do have a little bit of bad news to start off with, which is I don't know any great natural cures for cold sores in infants. As far as we know from the medical literature, there really aren't any. That said, cold sores in infants are a really serious topic, and it's something that we should talk about. So when we're talking about a cold sore in an infant, usually we mean that that infant has contracted herpes. Now, whenever we say the word herpes, people tend to panic. Oh my gosh, it's a sexually transmitted disease. No, most herpes is not a sexually transmitted disease. Usually it comes from somebody else's mouth. The mouth herpes and the sexual herpes has sort of become interchangeable, so you don't know if somebody has herpes anymore, where it came from. And in this case, it really doesn't matter where it came from. Now it's there. What does it look like? Well, usually it starts with a small blister or red area. It expands somewhere around the lips, and then it pops, it erodes, and then there may be a yellow crust. There may be some blisters around it. It will probably take a couple of weeks to heal up. When babies get herpes infections of the mouth, sometimes they get really, really nasty ulcers all over inside their mouths too. On the tongue, the gums, the cheeks, the palate, around the tonsils. That is one of the most unpleasant things that can happen to a baby. It is a horribly painful infection. They often don't want to drink very well, and keeping those babies hydrated can be a real challenge sometimes. So if you think that's going on, you see your baby has a cold sore and they're also drooling and refusing to eat or drink, you definitely want to have your baby seen by a doctor. Now, if you do think your baby has a cold sore, the only real treatment for it is one of a couple of antiviral medications, acyclovir or valacyclovir. These are usually given by mouth. However, if there's an infection that seems to be in the area of the eye, those babies may need to actually be hospitalized and given IV antibiotics. That's a very serious infection. It can even threaten the baby's vision. Acyclovir needs to be started in the first 2 days of symptoms to be really effective. So you want to bring your baby to be seen sooner rather than later. Now, we do know that good rest and good nutrition help people get over infections like herpes faster. Certainly you want your baby to be well rested, de-stressed, well nourished. Those are kind of our goals for our babies anyway, but if you've been falling off on that, you might make a little bit more effort. Talking about how to treat cold sores in infants, I'm Dr. David Hill.